President Yoweri Museveni bans use of private cars, imposes 14-day curfew in Uganda. President Museveni has ordered for a raft of measures to curb the further spread of the coronavirus in the country. Speaking yesterday during a live update, the president put restrictions on the use of private vehicles as well as instituted a curfew. Measure number 1 is to prohibit all people-to-people movement by everybody, including those using their private vehicles, bodabodas, tuk-tuks etc., he said. The president noted that although restrictions had earlier been made by having private cars carrying only 3 people, some people had resorted to using their vehicles to transport others, increasing the risk of spreading the virus. In addition to the banning of private vehicles on the road for 14 days, the president also instituted a curfew for the whole country to start on March 31 at 7 p.m. The curfew, however, he said, would not affect cargo planes, lorries, pickups, and trains. President Museveni additionally suspended for 14 days beginning April 1 the opening of purchasing malls, arcades, and hardware outlets, which he mentioned collect lots of people to promote and purchase non-food gadgets. All different non-food outlets may also be closed for a similar interval other than these, promoting agricultural inputs and veterinary companies, detergents in addition to prescribed drugs. The president mentioned whereas the Ugandan authorities had earlier put restrictions on gatherings, there are nonetheless home windows by way of which the virus can unfold. He mentioned many travelers have been flouting quarantine measures whereas others had escaped from quarantine, therefore the brand new restrictions. Mr. Museveni additionally mentioned locations like salons and garages might be shut for 14 days beginning April 1. Nonetheless, important companies like telecoms, banks, and personal safety corporations will stay in operation. We therefore think there is less risk of taking the bitter pill of less restrictions, he said. To prevent coronavirus. 1. Wash your hands frequently. 2. Maintain social distancing. 3. Avoid touching eyes, nose, and mouth. 4. Practice respiratory hygiene. 5. If you have fever, cough, and difficulty breathing, seek medical care early. 6. Stay informed and follow advice given by your healthcare provider. Also adhere to government regulations and guidelines. Subscribe to Kenyan News Today channel for latest updates.